Hello everyone. I am drberkkkaratas. We are in the 6th video of the Blackboard series. Our topic is infertility, sperm disorders, etc. Again, as usual, all of these topics are available in detail on the YouTube channel, section by section. Those who want to examine it in more detail can examine it. Now, when you look at the research on not being able to have children, 30 to 40% in men, in fact, as you can see, the problems in men are almost half of those in women, which is quite important. In other words, we can say that the problem in couples who cannot have children is mostly in women. Of course, it can be said that it is half. Now, of course, sperm analysis is very important in men. First of all, the first thing to do for those who cannot have children for 1 year or more is sperm analysis. We have some criteria in sperm analysis. These are very important. Of course, these criteria are decreasing day by day. For example, there should be 15 million sperm per millimeter. It needs to be 15 million and more. At the time of my assistantship, about 20 years ago, this average was around 40 million. It is falling day by day. They will do a renovation in 2023. Probably, this number could also drop to 10 million. In fact, we have started to accept even 12 million as normal. There are a lot of articles about this. There are many articles on whether men are becoming infertile day by day or whether human beings are becoming infertile. Here, for example, the amount of liquid coming out should be 1 to 3 milliliters. There should be 15 million or more sperm in each millimeter. In 40% of these sperm must be motile. In other words, an average of 32% of them should be fast and moving forward. 4% should be morphologically normal. Sperm has a head part, there is a body part, there is a tail part. When we look here, we should see a mobile, normal sperm with a structure called an acrosome at its head. How much is the rate? %4. Therefore, these criteria are important to us. When these criteria and are at the top, we call sperm normal. Now there are a number of terms that are subject to the disorder of the trench. In particular, it says in the trench evacuation. Before I forget, let me put it this way. For example, one of the most important issues in sperm analysis is that the first thing you need to do is to evaluate them. You can also look at it yourself, but it is very important to check whether your name and surname belong to you and whether there is the signature of the person looking at this test at the bottom. When you receive such a report, it is very important to pay attention to your name, surname and the signature at the bottom. Because someone has to take responsibility for this. Now let's say the sperm analysis is distorted. You have had a sperm test and the number may be small, the motility may be less or very little, the morphology may be impaired, the amount may be small, many things can happen. What do we do then? This is very important. First of all, we repeat this. Because, after all, they are taken care of by humans or, in some places, only by machines. Therefore, if a sperm analysis is defective, a single sperm analysis is not enough. Then we will repeat this. Where? To another center. Another I will look. If there is a problem with it, if the two are incompatible, for example, one of them looked at 20 million and one of them turned out to be 5 million, we will do verification at a third center. For him, repetition is very important. Of course, we will go to the doctor for examination. Men and women who will apply to the urologist are already going to gynecological diseases. Hormone tests are very important. This is the most neglected. So we have a form for sperm evaluation. From there, patients fill out forms and send them to us. In almost all of them, hormones are almost not examined. However, there is a hormonal cycle that ensures the cycle of the system and ensures the functioning of the system. This needs to be looked at. Is this working normally or abnormally? For him, hormone tests and, in particular cases, genetic tests are performed. Genetic testing is a topic in itself. But genetic tests must be done, especially in patients who we call azoospermia, that is, sperm disorder, or rather, who are never excreted, that is, of course, these will be 0, and no sperm comes out. These are the main points. Now, before moving on to these hormone disorders, the first thing we need to know is this: if there is a sperm disorder, it means that we will not find any cause at a rate of 40% to 50%. This is very important. In other words, at the point where medicine has come in today's medicine, we cannot find a reason in almost half of the patients. Or there is a reason, we don't know yet. What is our topic? The remaining 40 to 50%. Now, one of the most important causes of sperm disorder here is this 40%. Now we can divide these vital causes into 3. Reasons that you can change, partial change, and can't change. For example, we can change the following group: smoking, alcohol, sexually transmitted diseases, weight. This is something that we can change the group part of. It's something we can't change in this group, because genetics, old age, etc., these are not things that change. For example, there is very important information about smoking. A normal smoker has 13 to 17% less sperm content than a non-smoker, and in some studies it seems to be close to 20%. So if a non-smoker has 20 million sperm figures, we know that a smoker has around 12, 13, 14 million. Chronic alcoholic use is also the case with chronic alcoholism, sexually transmitted diseases, and especially recurrent and untreated, because they can cause prostatitis or inflammation of other organs. Chronic. They also have trouble. Weight, nutritional disorders, obesity. These are also important. Studies have shown that when the waist circumference exceeds 106 centimeters, sperm motility can be approximately 7 times lower than in normal people. In particular, it has a lot of influence on the movement. But overall, this is the group that we can actually change. In other words, if a person has a sperm disorder, he should smoke, drink alcohol, do sports, diet, etc. Pay attention to sexually transmitted diseases. This temperature increase is very significant. Among the things that can change the part. This is true for those who work in very hot environments. Why? Sperms, or rather eggs, are slightly lower than body temperature and far from body temperature. Women's eggs, for example, are in the abdomen, in body temperature, but not in men. In hot weather, the eggs hang down; in cold weather they are pulled towards our body. Reason? Because at an average of 35 to 36 degrees, that is, even 35.5 degrees, the best trench production is possible. If you are exposed to a lot of heat, for example, working in a bakery, working in large factories in summer, this can affect your sperm production. Now, of course, the issue of radiation is important, especially there are studies on mobile phones. Even between those who carry their mobile phone in their front pocket and those who do not, there is a serious difference in the direction of sperm movements. Therefore, wear your mobile phone more on the waist area, not on the front or back. But for example, cardiologists say don't include the heart area. So, of course, we were confused about what to put the mobile phone in. Everyone says something. Liverman call him. That's what heart doctors say. Perhaps it's best to keep it with us when we're not using it. Maybe we can have Bluetooth headphones on the road, or we can carry wired headphones in our bag. There are a lot of additives in mercury, lead, the environment, air pollution, the food we eat, etc. These are issues that we can change by eating healthy, but I don't think we can change the place we live in, the environment we live in, and the exhaust gases much. Stress leads to everything, so there's nothing that stress doesn't lead to. It is not the right thing to say avoid stress here. I mean, don't stress, don't do that. It's a phrase I don't like at all. Sometimes I go to the doctor myself and they tell me the same thing. Brother, don't stress, etc. But it doesn't work. It's not possible to do this in life conditions. By the way, the subject is to cope with stress, so I have stress in this field of work. If you think about how I can deal with this, things will be easier. Yes, the issue we can never change is the drugs we use. For example, some drugs actually cause sperm disorders, especially antipsychotic drugs. We can't change aging, we can't change genetic diseases. Cancer are already in this regard. Now there are two issues, a hormone disorder and a varicocele. First, let me talk about hormone disorder. Now there must be some conditions for sperm production. Just as these should be optimal, our hormonal balance is due to an order, a hormonal order. We have a gland called the pituitary, a tiny thing in our brain. There's a front side and a back. Thyroid hormones, that is, goiter hormones, are secreted from the back, and prolactin, the milk-secreting hormone prolactin, is secreted during motherhood, especially in women. It's very small. There are also two hormones on the front. FSR, LH. FSH is in the testicles. We have two tests. It causes sperm production in the testicles. LH helps to make testosterone in plants. Testosterone allows the development of a masculinity-type character. It goes back and participates in the production of sperm in the egg, in the facilities. And it ultimately turns into estrogen. This mechanism is a very important one. In other words, if a person has a sperm disorder, all of these hormones should be checked. Because the smallest mistake here, for example, a low FSH value, will prevent sperm production. Quit smoking as much as you want, don't stress as much as you want, do as much sports as you want, use all kinds of medications, nothing will change. So we need to look at this hormonal cycle. Most hormonal disorders originate from the testicles. In other words, in testicular failure or, for example, testicular failure, sometimes sperm production stops, but testosterone production continues. Because there are two different cells in the test. One group of cells makes sperm, and another group of cells makes testosterone. The production of testosterone varies. In other words, you may not have sperm production in a normal man in a 1.80 tall bearded and mustachioed testicle. You say, like a mountain, the man has hair all over him, but he doesn't have sperm production. The two cells are independent of each other. Of course, if testosterone is low, trench production is also affected. Apart from that, it is necessary to look at this hormonal balance. We can say that hormone disorders are under the most common categories. Also, as I said, an examination should be done. In fact, our goal in the examination is to see if there are natural facilities, if there are eggs, or rather, if there are facilities, what is the condition of the sperm ducts? For example, if no liquid comes out, there is no sperm. At the same time, if 0.3 milliliters of liquid comes out, there may be a blockage in the ducts. Why? There is a canal in both testicles that extends to the tip of the penis, that is, to the outside. Through that channel, the sperm go out. Those spermatozoa can get clogged. We need to look at the canal, but the most important issue we wonder is whether there is a varicocele or not. What is varicocele? We did a 6 to 7 episode series about this. Varicocele is the enlargement of the veins of the testicle. We can say that it is like varicose veins in the foot. What happens when those veins grow? I just said that when there is an increase in temperature, sperm movement and production slows down. When there are too many veins, the sperm goes there around the egg, around the testicle. Blood means heat. Our blood temperature is the same almost everywhere in our body. Our temperature in all veins is the same. So what happens? There is an increase in temperature. When there is an increase in temperature, there may be a shield disorder. Varicocele can be seen in 15% and 15% of men. About 10% of them can be operated on due to sperm disorder. The most important cause of sperm disorder that we can detect today is varicocele. Now, I have a lot to say about varicocele, but let me say 2 basic points. Keep that in your mind today. Examination is enough for a diagnosis. Sometimes he says, the doctor looked at me, diagnosed me with varicocele, did not do any tests. Both grading and recognition of varicocele are also examined. You can ask for an ultrasound on something you've seen, or if you suspect the testicles are small or something else. But it doesn't have to be done, especially with a Doppler test. It's like taking an X-ray to see if someone's nose is broken. If you are going to intervene, then some examinations may be requested in those works. That's the first issue. The second is from varicocele. There is no drug treatment or any other treatment for varicocele. Surgery should be performed. There is only one rule for surgery for varicocele, and that is sperm disorder. In other words, a person has a third-degree, extremely high level of varicocele. It does not bother aesthetically, it does not cause pain, there is nothing. Their sperm is also normal. That person doesn't need to have surgery. But he is varicocele, his hormones are normal. There is also such a situation. In other words, it is not very correct to attribute it to varicocele because there is a sperm disorder in every varicocele patient. Fix the others first. If the man smokes 4 packs of cigarettes a day, you quit smoking, you start exercising, you reduce the heat, you regulate your hormones. Let's see if it improves. If it still does not regulate, if there is still sperm disorder, then surgery should be performed. If there is no sperm disorder, it is enough to follow up. How long will we follow? If there is no sperm disorder, it can be followed up for life or it can be looked at itself. This is what I'm going to tell you about sperm disorders in general. I'll tell you something. This is a lot of infertility, so this infertility and so on is not in this case, but it concerns athletes in particular. We also have a video about it. External testosterone intake is a very important condition, so let me talk about this by the way. Now look at FSH from the front of the pituitary, LH, let's draw this again. Testosterone is secreted from here. Now testosterone was turning into estrogen and coming back again. Now, if this system, that is, the system we are talking about here, works normally, that is, if a person's FSH, LH, etc., which works from the pituitary gland over there, if these are normal, if testosterone is normal, taking testosterone from the outside at a low level of testosterone is one of the biggest evils a man can do. Why? When you take testosterone from outside, testosterone automatically increases. Rising testosterone is already in excess in the body. It turns directly into estrogen. Also, especially if there is adipose tissue, it turns into estrogen. Estrogen has such a feature. It comes through negative feedback and has a negative effect on them here. In other words, when you take testosterone from outside, yes, your testosterone increases, but your FSH and LH value decreases. Why? Because that's how the body perceives it. There is plenty of testosterone. I'll stop here then. It does this through estrogen. Your FSH, LH value decreases. Therefore, both your sperm production decreases and your own testosterone production decreases. What happens? You become dependent on the testosterone out there. What happened? We have disrupted the system that functions with health. This is very important. This is one of the biggest mistakes athletes make, taking testosterone from the outside. Here, there is a sperm disorder and such a number as motile and testosterone can be given from the outside. Doctor friends also do this. If testosterone is low, if the system is functioning normally, testosterone is not given externally. What is it made of? Then it can be normal, or if the FSH-LH value is slightly low or normal, to increase testosterone from the inside. When you increase them, it will automatically increase testosterone and sperm production. So it's a complicated mechanism, but let me tell you, when you are given testosterone intake from the outside, you have to question it a little bit. Do you really need it or not? How is the situation inside? Can there be production inside? Because otherwise, when the intake of testosterone from outside stops in the future, after a while, testosterone does not produce sperm at the bottom, and even those who take steroids, such as athletes, take steroids. This situation is much worse than those who take steroids. Permanently, this system can be completely suppressed. Therefore, they also develop DECA-Dick syndrome. For example, a number of problems such as erectile dysfunction and inability to have children occur after post-steroids. We also have a video about it. You can watch it if you want. In general, that's all I want to say for now. As I said, the details are available on my YouTube channel. Thank you for liking it.